Hello everyone, we are students of Ashok Mane Institute of Pharmaceutical Sciences and Research Save. Today we are presenting seminar on topic Community Pharmacy. Presented by Sakshi Patil, Tejas Dobre, Amit Satale, Vaishnavi Patil, Bhakti Kumbhar, Shravani Chavan and guided by Mr. A.N. Dage sir. Content: First, definition. Second, importance. Third, community pharmacy in India. Fourth, organization of community pharmacy. Fifth, structure of community pharmacy. Sixth, types and design of community pharmacy. Seventh, layout and design. Eighth, legal requirements. Ninth, dispensing of proprietary products. 10, maintenance of records. 11, importance of record maintenance. 12, summary. Definition: According to James W. Richards, community pharmacy is defined as an establishment that is privately owned and whose function is varying degrees is to serve society's need for both drug products and pharmaceutical services. Key role: First, most accessible source of drugs and drug information. Second, provides pharmaceutical care and health services. Community pharmacy in India, mostly product oriented and commercial, need to shift to a patient-oriented service. Developed countries have qualified pharmacists like PharmD and MPharm. Emphasis on counseling, consultation, and accountability. Organization of community pharmacy. When organizing a pharmacy, location is the first consideration. Ideal locations. First, near clinicals or hospitals. Ensure prescription flow. Second, in busy areas like towns, markets, or near residential colonies. Third, in new urban areas. Steady growth potential. Other options such as bus stands, railway stations, shopping malls, or apartment complexes. Structure of community pharmacy. Community pharmacies can be organized under three categories. First, sole proprietary concern. Second, partnership concern. Third, corporation. First, sole proprietary concern. Owned by a single individual. Simple setup and full control. Profit and risk belong to one person. Can be expand or dissolve anything. Second, partnership concern. Owned by two or more individuals. Governed by partnership deals. Task profits and losses shared as per agreement. Easy to form and dissolve. Third, corporation. Legal entities established with government approval. Shareholders have limited liability. Complex process to set up. Example, chain pharmacies. Types and design of community pharmacy. There are three main types of community pharmacies. First, small scale ordinary type. Second, large scale superstore type. Third, modern patient oriented type. First, small scale ordinary type. Floor area should be 120 square feet. Limited stock and staff up to 3%. Meets basic community needs. Disadvantage: limited services and space. Second, large scale superstore type. Floor area should be 500 square feet. Large display and customer movement area. Wide range of goods, long working hours. Disadvantage: high capital and overhead cost. Third, modern patient oriented type. Run by qualified pharmacists such as MPharm or PharmD. Offers patient counseling, consultation, health monitoring such as blood pressure, sugar, etc. Resembles a clinic within a pharmacy. Common in developed countries. Layout and design. First, small scale pharmacy layout. It includes display racks, sales counter, and fridge. Second, medium scale pharmacy layout. It includes customer waiting area, display racks, and sales counter. Third, large scale. It includes working table, store room, and counseling rooms. Separate areas for patient education and consultation. This image shows small scale pharmacy layout. This image shows medium scale pharmacy layout. This image shows large scale layout. Legal requirements. For starting a wholesale or retail pharmacy, a license from the Drug Control Department is required. The procedure to obtain a license is given in detail in the Drug and Cosmetic Act and rules. These licenses require specific forms to apply, renew, and receive. They are given in the table below. This table shows license and forms for drugs other than Schedule C and C1, drugs in Schedule C and C1, drugs in Schedule X. They are different and given in below table. The legal requirement for starting wholesale. First, pharmacist or qualified person required. Second, minimum 10 square meter storage area. Third, drugs to be sold only to licensed retailers and hospitals or institutions. Fourth, authorized officer records for purchase, sale, and stock must be maintained. Legal requirement for retail sale. Three types of license. First, drugstore for household remedies and non-prescription medicines. Second, chemist and druggist, dispensing of prescribed medications. Third, pharmacy, compounding and dispensing under a registered pharmacist. Dispensing of proprietary products. Proprietary products. Drug prepared by a company under its own formula and brand name after approval. Dispensing methods. First, from manufacturer's bulk container, properly measured and labeled. Second, dispensing manufacturer's original pack, sold in prescribed quantity. Dispensing of proprietary products. Proprietary products. Drug prepared by a company under its own formula and brand name after approval. Dispensing methods. First, from manufacturer's bulk container, properly measured and labeled. Second, dispensing manufacturer's original pack, sold in prescribed quantity. Maintenance of records. Three main types of records. First, legal records. It includes purchase register, sale register, stock register, Schedule X and C or C1 register, inspection and communication files. Second, financial record. Daybook, journal, ledger, profit or loss accounts, tax receipts, salary register. Third, patient records. Patient medication profiles, family medication history, prescription and laboratories for reference. Importance of record maintenance. First, legal compliance and accountability. Second, transparency in financial management. Third, helps in patient care and counseling. Fourth, prevents misuse of drugs. Fifth, supports audits and inspection. Summary. Community pharmacy is a vital link in healthcare. It serves public health through medicines supply, counseling, and education. Requires proper organization, licensing, and record maintenance. Moving towards patient oriented service ensure professional growth and better healthcare delivery. Thank you.